الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Standard and Additional Precautions by Professor M. Hani Suleiman. General. We will begin 5 lectures for infection control. Infection control is very important for protection of patients and healthcare workers and the environment from infection. It is important for all healthcare workers, even students at any faculty for medical subjects like faculty of medicine, dentistry medicine, pharmacy, veterinary workers, nursing, and so on. It must be implemented all over the day, all over the week, for every second. We'll begin the general for these standard precautions. Infection control and prevention uses a risk management approach to minimize, prevent transmission of infection. Standard and additional precautions principles SAP and practice based on mode of transmission of an infectious agent. This is why we give the general approach about epidemiology and preventive medicine. Standard precautions equal work practices required for basic level of infection control. They include good hygiene practices, particularly washing and drying hands before and after patient contact. Use of protective barriers, which may include gloves, gowns, plastic aprons, masks, eye shields, or goggles. Appropriate handling and disposal of sharps and other contaminated or clinical infectious waste, and use of aseptic techniques. يبقى washing hands, personal protective equipments, handling of sharps, aseptic techniques. SAP apply to all patients regardless of their diagnosis or presumed infectious status in handling of blood, all other body fluids and secretions and excretions except sweat, regardless of whether they contain visible or not, regardless whether they contain visible blood or not. Non-intact skin, mucous membranes, mouth and eyes. SAP also apply to dried blood and other body substances including saliva. SAP should be considered a minimum requirement for infection control. It is a minimum requirement. Implementing SAP minimizes risk of transmission of infection from person to person, even in high-risk situations. SAP should be implemented at all times. It is in red, particularly when patients are undergoing invasive procedures, including catheterization, cannulation, or intubation. Health services that offer SAP should provide detailed written protocols for patient management in their infection control procedures manuals. This is a must in every hospital, every clinic. Additional precautions equal work practices that should be applied in healthcare setting for patients known or suspected to be infected or colonized with infectious agent. It is given for patients known or suspected to be infected or colonized with infectious agent that may not be contained using standard precautions alone. What are the standard precautions? Use of SAP is essential as primary strategy for successful minimization of transmission of healthcare associated infection because infectious patient may not show any symptoms or signs of infection that may be detected in a routine history and medical assessment. Patient's infectious status is often determined by lab tests that may not be completed in time to provide emergency care. Also, patients may be infectious before lab tests are positive or symptoms of disease are recognized, the so-called the window period of disease. People may be placed at risk of infection from those who are asymptomatic but infectious. Standard precautions for infection control in healthcare settings consist of the following work practices. These practices must be done at any work about health. Aseptic technique for all invasive procedures. First, aseptic technique. Second, personal hygiene, especially hand washing and drying. Thirdly, 70% of alcohol-based chlorhexidine. Then, personal protective equipment. Then, handling and disposal of sharps. Then, reprocessing of reusable equipment. Then, environmental controls. Then, support service as laundry and food service. يبقى aseptic technique for all invasive procedures including appropriate use of skin disinfectants, personal hygiene practices, particularly hand washing and dry, before and after all significant patient contacts, use of 70% alcohol-based chlorhexidine, 0.5% hand rub solutions as an adjunct to hand washing, not substitute for hand washing. Use of personal protective equipment, which may include gloves, impermeable gowns, plastic aprons, masks or face shields, and eye protection. Appropriate handling and disposal of sharps and other clinical infectious waste. Appropriate reprocessing of reusable equipment, instruments, including appropriate use of disinfectants. Environmental controls, including design and maintenance of premises. Maintenance is very important. Maintenance of premises. Cleaning and spills management. So any spills must be cleaned and managed, including appropriate use of disinfectants, appropriate provision of support services as laundry and food services. Additional precautions to standard precautions. Additional precautions used for patients known or suspected to be infected or colonized with epidemiologically important or highly transmissible pathogens that can transmit or cause infection by following means: airborne transmission, pulmonary TB, e.g. pulmonary TB, chickenpox والmeasles; droplet transmission of respiratory secretions as rubella, pertussis, influenza; contact transmission, direct or indirect, with patients who may be disseminators of infectious agents of special concern, e.g. dry skin of those colonized with multi-resistant Staphylococcus aureus, MRSA; fecal contamination from carriers of vancomycin-resistant enterococci, VRE, or contaminated surfaces. This is to be continued. Inherent resistance to standard sterilization procedures or other disease-specific means of transmission where standard precautions are not sufficient. Patients with known or suspected Creutzfeldt-Jakob disease. Any combination of these routes. Additional precautions are designed to interrupt the transmission of infection by these routes and used in addition to standard precaution. In addition, it is not a replacement for standard precaution. When standard precautions alone might not contain transmission of infection, additional precautions may be specific situation for which they are required or may be combined where microorganisms have multiple routes of transmission. Additional precautions should be tailored, should be adjusted to a particular infectious agent involved and mode of transmission, and may include one or any combination of the following. Allocation of a single room with ensuite facilities, a dedicated toilet to prevent transmission of infections transmitted by contact with fecal materials, as for patients with infectious diarrhea or gastroenteritis due to enteric bacteria or viruses. Cohorting, which means room sharing by people with same infection. Cohorting may be an alternative if single rooms are not available. Special ventilation requirements, for example, monitored negative air pressure in relation to surrounding areas, special ventilation requirements. Additional use of PPE, for example, healthcare workers of patients in respiratory isolation should wear a well-fitting mask, a 0.3 millimeter particulate filter mask, which is P2 or N95 mask is recommended. Rostering of immune healthcare workers to care for certain classes of infectious patients. So, if you want healthcare workers to look for a chickenpox case, it is better, but in my point of view, it is a must that the healthcare worker be immune to this disease. Dedicated patient equipment, restricted movement of both patients and healthcare workers. This table in this slide and the table in the coming slide for summarizing what we said about additional precautions. Gloves for contact diseases, apron or gown when there is substantial contact with patient and patient excreta, respirator or mask as P2 or N95 for droplet infection and to protect face if splash is likely. Goggles and face shields to protect the face if splash likely. Special handling of equipment as per standard precaution. Single room, yes, it is better. Negative pressure, yes, for airborne diseases, especially pulmonary TB. Transport of patients, during transport it is used. Mask. Other, encourage patients to cover nose and mouth. This is all for this lesson. ولا يبقى إلا أن أقول الحمد لله و thank you.